first, just wanted to thank everybody for coming. We're trying to do these on a more routine basis, so thank you all for taking the time to come up and participate. Just a quick update from me on the north building. That project will probably be done by the end of July. We're going to start putting the carpet in this week. And there's a variety of other stuff that still needs to be done, but we're probably looking at the end of July. We'll probably have an open house over there sometime like mid-August. Started the conversation with the priest that's kind of spearheading that yesterday and working on some potential dates. So we'll just be independent living. So they will get meals, which is something Elizabeth and I have to talk about more and work out the logistics of that. But as it stands right now, it looks like we've got 2 or 3 people that want to move in pretty much right away. There will be 12 rooms plus 1 guest room when it's all complete. So that's kind of where we're at with that project. So just a little brief update on that. The other thing I was just going to mention is just really just saying thank you to you all for all your hard work and effort. Even though we're kind of moving a little bit gradually post-COVID, I don't know if we can really use that phrase, but things are kind of gradually returning to normal, you know, but we still do have these fun things to wear every day, and now we're back in the testing piece. If you haven't been boosted, you have to be tested, which I think everybody's aware of that. Allison's hunting people down related to that. But my main point is just to say thank you. I know these last 2 years have been very challenging on a variety of different levels, but COVID just was a complete game changer for everybody. So just thank you for sticking with it and sticking with us, and we'll just keep moving forward. So thank you very much.
Thank you. All right, so I'm Erin, for anybody who doesn't know me. My position as mission coordinator was created, took over this position in March. So I just wanted to talk a little bit about some of the things that we're doing regarding kind of our culture. And a couple weeks ago, we sent out a survey, go ahead and go to the next slide, asking you all about where you saw compassion here, because that's one of our values. And so as one of our organizational values, I just wanted to kind of highlight that. Especially because part of the reason for that survey was to get some of your all's feedback on it and kind of where it is that you see it and what it means here at Nazareth Home. And these are some of the reoccurring words that came up with it: caring, love, others' feelings, respect, understanding, dignity, and kindness. And I think that all of these have very big places within compassion, but you can see that it's kind of, that it encompasses a lot. Go ahead and go to the next slide. So I found this video, and unfortunately we can't show it in here because of our Wi-Fi, but I'm going to send it out later today for everybody to see. And it's about the difference between sympathy, empathy, and compassion. And so I really hope that everybody watches this video, because I think it's important as an organization for us to get on the same page about what compassion means here and what does it mean for us in the job that we're doing here at Nazareth Home. But one of the main points of the video that I want to make sure that everybody hears is that compassion is about understanding, hearing that person, knowing where they are, but most importantly, it's about doing something about it. It's about doing something to really actually relieve their suffering in some way. And so I think it's important for us to recognize where it is that we are doing that in our jobs. And from the surveys, it was very clear that everyone that answered the survey sees compassion, whether it's in something that they do or in something that a coworker does. But I do think it's important for us to remember that compassion is about us and our relationship with our elders, but also in our relationships with our coworkers. All of those things that we do day in and day out, working to the last minute to make sure that our coworker is stepping into a good shift where they can give care to the elders immediately, whether that means answering all the call lights to the last minute of your shift, or making sure that your cart is stopped, or you give a thorough handoff, or whatever it is to set up your coworkers for success, those things are things that we are doing, and we recognize that we need to be doing those things for our coworkers, because we don't know what coworkers are going through. Some days they're having that hard day, and so we do need to say, please go take your lunch, get off the floor, I'm gonna take care of your patients for this time, I know that you need this. And us doing that for our community is what helps us create this culture of compassion, not just with our elders, but with our coworkers. So a couple other things with our culture that we're gonna focus on is strategic goal setting. So Craig is gonna be leading every department in some strategic goal setting. And with that, we really want to just kind of communicate to you all that we want the Clifton campus to really be a place that is striving for improvement. We know that no matter where you are, the best places in the world are always changing and striving for improvement, and that's what we want. We want to really be thinking about what are the things that we can do better, what are the things that we can look at and we can improve here. So with that, we really need to work on that communication, and we really want to hear your all's feedback to help us with this goal setting process. So we do use on-shift texts and emails, and that's our main means of mass communication with the campus. And so just want to just kind of give those reminders to make sure that you are getting those, you are reading them, because it is our way that we don't have a meeting every single month, or we don't have meetings every week. So please make sure that you're checking with those. We also want to request that you are completing your pulse surveys, because you get those, I think there's an algorithm, but you get them about once every 7 shifts somewhere, or somewhere once within those 7 shifts. And when you all do those pulse surveys, that's how we're getting our feedback from our employees to understand what's going on the campus. So please, please, please complete those, because we want to get that feedback, and we want to make sure that we have a clear understanding of what is happening and how people are doing on the campus. And as a leadership team, we are making a commitment to go over those surveys once a week. So we will be reviewing them. We do want to communicate back with you. So please know that we are looking at them, so please complete them. And then we also wanted to just mention that we're starting to do short videos. So Allison is looking at doing it with some education stuff. And we're doing some like 30-second to maybe like 3 or 4 minutes videos. So please watch those when we send the links out on shift, because that's a way for us to get out some little information without sending articles to read, or making someone do another healthcare academy or something. So make sure that you're watching those things, because those are ways for us to get some of that immediate information out without some of the more boring stuff. Please make sure that you keep your cell and email preferences up to date on shift, and make sure you're getting those messages, because we want to make sure that we are communicating with everybody in an effective way, and this is our main means of communication. So a couple feedback updates from employees that we just wanted to highlight is that we did receive some feedback that there are some hurdles to employees completing their healthcare academy on a monthly basis. So if you are someone who has some hurdles to completing that, we would like to get some feedback on that, because Allison and I have talked a little bit about this, and we'd like to hear some feedback about what are those hurdles, so that we can make sure that we're getting the right accommodations out for employees that need them. So please make sure that you're letting us know what those are, because that is how we stay up to date on best practices, and we're making sure that all employees are informed on best practices and making sure that we're doing everything in the right way. Then also, we got feedback that this campus used to do WOW cards, so thank you for bringing that up. And we are implementing, we're just gonna be calling them applause cards now, because that's what the other campus uses. And so we already had the design for it. So if you wanna go ahead and click to the next slide. So we're gonna be putting boxes at all of our common exits, and they should be up in the next couple weeks. So please encourage, if you hear someone give an employee a compliment, especially elders and family members, direct them to the applause cards, because we want to hear that applause that people are giving you, those thank yous, and we want to make sure that there is an outlet for you all to get that thank you, because we know that you guys are doing a great job and we want to make sure that you're hearing that. So please make sure to encourage people to fill those out, and just kind of be watching for that. We'll send out some information about those exact locations when they go up. All right, and then last thing for me is that Allison sent out information, I believe last week, with this link for the Alzheimer's Walk. So that is in October, so know that there will be some things coming out about that, but you can look in that on-shift link for the direct link, but this is the information about it. It's October 15th at Slugger Field. So I know that we had several people who did the dementia training in our, what is it, the title, certified?
Oh, can't remember. Practitioner.
Certified dementia practitioners. Yeah, so we have several who completed that training, and so we're excited to kind of bring some of that to our campus a little bit more and to be more educated about that as well. All right.
Thank you. Thank you.
All right, hi everybody. If you don't know me, I'm Jennifer Smith. I'm the HR director for Nazareth Home. I live on the Highland campus, but I'm over here more often than not, I guess you say, working with, and you might see a lot of faces I know and who I've been working with. But today, just to sort of lean off of what Aaron was talking about, we've been talking a lot about how do you show a culture, how you show a culture of respect. And I just had some top 10 things as what that sort of means. And honestly, a lot of times when you talk about respect, it really goes beyond the person. It honestly, it's respect for rules, deadlines, policies, punctuality. That's kind of HR-y stuff, I guess you could say, so that's why I'm standing up here for you. So some of those things that, though, number one, the first thing I like to say is that when you have rules and regulations in buildings and culture of respect, you just want to say something if you see something that's not quite right. Things such as that are something simple as maybe if you see somebody smoking in the wrong area, off the campus. There's reasons for that. We want people to make sure that the building doesn't catch fire. It's been very dry, and of course the beautification of the campuses. Or those cell phones where you see people that are constantly on cell phones, and you want to try to say, hey, we try to make sure that we're not walking around on those phones and loud. As a matter of fact, when I just left the building, I had somebody that was sitting right out front and was just walking down the hallway, one of our employees, and what I did with them is I didn't say, get your cell phone and put it away. I just kind of gave them a gentle nudge, and I go, hey, I want to put that away, and she was just like, oh gosh, I forgot. It's a gentle nudge of just saying something to somebody instead of just, laying the hammer down on somebody and letting them know that's, again, a culture of respect and just reminding each other of those things. Another thing is the simple act of smiling. When you smile, it's like anything. If you see somebody that's smiling, that's a welcoming, that's a friendliness. We got accused of being a friendly campuses. That's a nice thing to be accused of when you see somebody smiling. Somebody says, well, I got a mask on. I can tell when you're smiling. I can tell when you're frowning too. It's easy to see even through the mask. But it's a culture of respect that you create when you do those things. Number 3, just saying thank you and mean it sincerely. Just like Craig, it was just very natural just to say thank you all for everything you've done, because it has been difficult. And I've been standing in front of a lot of our staff, over the past couple weeks as well. And to work in long-term care, you got to have grit. I'm telling you, you are probably the grittiest people around. The fact that you can just stick with all this type of stuff, and the simple act of thank you and the kindness to each other for things that we've been doing and things that maybe somebody's been going through the pandemic as well, leading up to all this, but thanking you for sticking with us and doing those things. But it's an act of sincerity and also, again, a culture of respect. Number 4, just be considerate and discreet. And also what that means is be mindful of your surroundings. When you're in the hallways, or if it's in the evenings and maybe some of the residents have gone to sleep, just making sure that you are aware that you're in someone's home and being respectful of the fact that this is where they live. And they might have wanted to lay down a little early, and that doesn't mean we have to be loud, because they might be a little bit hard of hearing. We want to be mindful of those things. And then also the people around us. If we're standing out there and we might have a disagreement with somebody, it's much better to walk away and talk about those things instead of talking about that in the hallways to make other people feel uncomfortable. Number 5, apologizing. Apologizing is courageous, meaning that if you just apologize for someone, just say, I screwed up, without 5 excuses to follow as to what somebody happened or what somebody did, and just say, I screwed that up, I own it, and move on with it. That's the best thing you could ever do. And it takes a lot of courage for people to do that, including leadership of just anyone in our roles or anything like that. Say, that's a screw up, I own that, and move on. It's respectful for people to be able to understand that. Number 6, participating constructively. Meaning that if you are involved in a meeting, if you're around people and you're supposed to be involved in something together, stick on topic, because people's time is precious. Meaning that just coming to these meetings today, coming in here, and we want to make sure that we stick on topic and move quickly through what we want to get the information to you. Your undivided attention for those things is also appreciated when you're in any meeting around people, and that's again another culture of respect. Number 7, respond to something or anyone in a timely manner. If someone asks you for something and you say you're going to do it, and you say you're going to do it, don't anticipate that person having to keep following back up, or for that matter, if you're on the floor speaking with a resident and you say, I'm going to be right back, it might be a few minutes or whatever it is, but you are responding. Or even if it's not tomorrow, just make sure you say, I can't get to that today, but I will do it the next day. Whatever it is, to make sure that person knows that you are respectful of their question and everything too. Going the extra mile is number 8. That just means that you do the small things that help each other. And then I forgot to say this the last time in our last town hall here, is that make it help people recover. We all stumble sometimes, meaning that we mess up, and you might see somebody that says something wrong or something like that. You help that person recover instead of saying, oh, they do that all the time, or things like that. You want to help each other do that. Go that extra mile to let them know that you're in it with you together. Number 9, being reliable. And that just means that I can count on you. I can count on you even if I know that you're going to be sick, or if you're not going to be able to attend something, that you respond and you let somebody know that, I heard you, I got that. Even that's reliable, because they know that you saw it, you're expected to be there, and they can count on you to even know what they need to get from you or showing up on time. And the last but not least, number 10, feedback. Feedback is an absolute gift. It truly is a gift when someone can actually just provide you feedback, when it's maybe sometimes unsolicited, but you take that feedback as a gift that someone's giving to you, and not a criticism, and not personalizing it. Meaning that if someone is telling you something about something, it's not because they want to criticize, they're trying to help you, but don't take that personal along that way. It's a definite thing that's also another gift and a culture of respect. So this is a few top 10 things I just want to kind of bring about as some of the things that we could do to help create that and continue to create that culture of respect. And along with that, when you have culture, when you have good culture, yes, it goes around with recruiting. And when you can get people that want to come to work and be at work, that's how we get the most of our folks, is from recruitment. Believe in referral bonuses in our orientations. Half of them at our last orientation, the last few, have all been from referrals. So I do want to remind you about our referral bonuses that we still have going on. Actually, we're supposed to end it on Thursday, but we might give that a little bit of a nudge and an extension as well. And what we're doing on that is we're doubling that, meaning that if you kept someone, and it doesn't matter what campus, if they come to this campus, the other campus, it doesn't matter what position it is, but if we hire them in a full-time or a regular part-time position, after that employee's been here 60 days, right now it's at $300. Once they've been here for 120 days, it's another $300, and after a year, it's $400. So it's a $1,000 referral bonus for each employee that would actually be hired. So that's a great opportunity to continue to do that, and again, bringing people in any department in those roles. And last but not least, I just want to remind everyone about the Sandra King Scholarship Program. I think Melissa sent something out again today as a reminder. If you have anyone that's interested in furthering your education, the deadline for that is July 6th, and you do have to be 6 months employed. You have to be full-time or regular part-time, good standing, and then also $1,500 per semester, and for 2 semesters you can get up to $3,000 to help out with some schooling. So I just wanted to remind folks about that, and thanks for being here, and thanks for listening, and turn it over to Mary. Thanks.
Thank you, Jennifer. Hello, everybody. Good afternoon. I'm Mary Haynes. I told the group yesterday I've been with Nazareth Home now for 21 years. November 21, I started. And while there's been a lot of change in that time, really, what never changes about Nazareth Home is our brand, and what we offer to the community is service. And that service is delivered in the speech and the smiles and the touch of each of you. So you're where it's at when it comes to Nazareth Home. You are the product. It's really all we have to offer. And we hope that people can see and hear and feel what we do and have trust. And that trust is so important to our future. So 3 months ago when we were here, we talked about census. We had some charts on census. We looked at where we've been. We also talked about wage. We talked about the commitment that we continue to make through those very depressed times in lifting your wage to the extent that we can. So today we want to talk a little bit about feedback. Last time I was here, I asked if some of you would participate in some small groups with us. You did that. I see some of those faces this afternoon who were kind enough to do that. And what we did was we tried to kind of validate what we see in the literature about the reason that people leave jobs and the reason they're satisfied in jobs. And so what we heard from you is exactly what we read in the articles, that the number one thing we all want is respect for who we are. We want a clean, healthy relationship with the people that we work with, and we need to have the tools. We need the supplies, we need the environment to support the work we're doing. So, as Aaron mentioned, the surveys. So we've done a lot on the other campus with trying to push out these survey questions and get the response rate up. So we really can take the temperature of the team. I always say, I grew up in the country. I grew up in the middle of nowhere. And here's what I learned. If mom ain't happy, ain't nobody happy. So I know when a lot of times as I interview team members, they're always saying, I'm here for the resident. I'm here for the resident. I put the resident first. I'm always here to say, if you and I aren't working well together, then neither one of us are going to achieve putting that resident first. Because if our work group is not healthy and supportive and operates out of a sense of goodwill and trust, frankly, I don't think a lot of good things happen. So every minute that we can spend thinking about the way we interact with each other, and as Aaron said, lifting people up, and as Jennifer said, helping people recover from a mess up, it's time well spent, because that's what really matters in our environment. So I have for you some turnover information. I think I gave that the last time and matched it up between the two campuses, and really it's just quite a lineup. There's always about, you can go on, there's always about 20 some odd open nursing positions. We talked about that a lot yesterday. We probably could do a better job letting you know exactly about these positions and helping you be part of the recruitment for them, and that way build that referral bonus up, because you are who's going to make a difference. You are who's going to keep people at work. So our averages are about the same as everybody else's. Unfortunately, the turnover in nursing specifically across the country is knocking on the door of 70. If you noticed, you probably didn't, on that sheet that I had before, we're showing a 23%. We realized we got an Excel problem there. It's really more closer to 40. So anything that we can do together to improve those numbers, it improves the life of the elder, and it improves our day too. Go ahead, please. So We have been 5-star here for a long time. We've been 5-star on the other campus since the 5-star was created. There's a lot of numbers. Amy is an expert on those numbers. There's a lot of moving parts, and Tina too, that go into the buildup of how you get that 5-star. But the government grabs our payroll information, so this isn't anything that I can impact, Craig, Jennifer. It comes straight off of what our payroll grabs. It's done by a third party. So we are 3-star in staffing. So people ask me about that. Mary, how come you're 3-star in staffing, you're 5-star in everything else? Well, it calculates around a strong preference for the registered nurse. And I think all of us know we have great licensed practical nurses in our environment. And in the long-term care environment, we all know what's needed. What's needed is consistency, support, a good bit of science, a lot of planning, evaluation, and correcting things. Strong communication with family, strong preference by the elder, that makes for success in long-term care. We believe we're doing that. So when you look at these hours, you see that we've got an absolute matchup, facility average, when you look at the total number of the national in Kentucky. We're doing good. As you come on down, you see that as it relates to LPN hours, we're above the benchmark. So I want you to know, on your tough days, and I know you have them, this is science here, this is pure math, and it comes off what the government has about us. So we are doing well. But with everybody's help, I think we can up some of these numbers. Vaccinations, we're doing great. Craig mentioned that. For those of you now that are like me and over 50, that second booster is now in the definition of your being up to date. So if you haven't gotten it, jump out there and get it. I've had it. I never knew it. Just get the stick. It'll be easier on you. It's easier on the nurse leadership that have to do the testing. And when it comes to the elders, it will prevent us from isolating people if they get an exposure. So I know we're all worn out with the government putting out one more thing, but as Nike says, just do it. Meet the requirement, then we get on with the good stuff. So, pulse surveys. Please know that they're read and appreciated, and we are hoping to make decisions from them. So everybody's seen the sign that says your opinion counts. It truly does count, because we don't want to go off on any strategy without having a good understanding of the climate of the team and how that team is doing. My understanding is our current response rate here is 30%. I'd like for that to be at least 50. We're up to 50 on the other campus. It really just takes us all saying, okay, when I get pinged, I'm gonna respond. Please know nobody's saying ping Lindsay. It doesn't work that way. It's a random, a logarithm, it just gets pushed out. Now, if willing, we do know that Lindsay completed that survey, but Lindsay's not being targeted. So if we could get every department up to at least 50% participation, then we would be able to feel and know that there's really a lot to be paid attention to if the surveys are saying something is not right, right? We had some on the other campus, people actually wrote, I think they're mean. and this was a new employee, right? So I pay attention to that. Okay, talk to me more about that, because I want to clean that up. So please fill them out. So here, this is environmental services. All the blue line, that's the way everybody at Clifton is feeling in this period. So we're going from 80 to a little below 80 as far as percent satisfaction. That's the blue line. The orangey line is the way the team in environmental services feel. And their positivity is moving up. That's awesome. That's great. The next one is nursing. So again, the blue, that's all of us. That's everyone here at Clifton who is responding. And again, it's 80. You know, it's got a little pitch and then it's starting coming down. And then you look at nursing and there it goes. So we have room to improve. And that's really what it's all about. There's really never anything that couldn't be improved. No shame in that. But it gives clues, it gives strategies, it gives us work to do. So the good thing about things like this is it gives us goals, it lets us dig, and it helps us to be better. So thank you for everybody that's filled that out. Best places to work, hopefully you've heard about this. We got into this competition. I always say we've been in a lot of competitions over the years. We've received a lot of recognition. A lot of times it was around our patient satisfaction, our clinical outcomes, which we still boast the lowest return to hospital admission rates in the city. We do a great job clinically. But the job that we're really wanting to do is what we're talking about here this afternoon. We want to have the best environment to work in the city, and that's the path we're on with your engagement and your empowerment toward that. So we had to have 50% of all the employees that we listed, which was about 380, and we did that. And then that 50% had to say, 85% of those 50 had to say they were very satisfied, and you did that. So give yourself a round of applause on that. I'm gonna ask you, why do you think this important, or do you think this is important? Why do you think it's important?
It'll encourage people to want to come here and work.
That's the, yes ma'am. That is the whole point. So when people say nursing home, you know, you and I love it. You couldn't blast me out of it, but I think we have to agree that's not the common perspective. When people hear about our environment, typically it's not an immediate trust or running towards. That works for elders who come, patients who come, and staff perhaps who come. So trying to change that perspective, things like this are so important. So thank you for doing that. Everything that we can do to build trust in the community is really where it's at. So thank you. I appreciate your time this afternoon. I'll hang around if anybody has a question of me. Fire it out now or after we close, which we're about to. All right, amen. Thank you.